Hello. Today I'll be talking about measles, the virus, how it spreads, its complications, and why prevention is crucial. Spread exclusively among humans, measles is a highly contagious virus that at one point was responsible for an average of 2.6 million deaths per year prior to the development of the vaccine in 1963. As we will later see in this presentation, measles can lead to severe complications in unvaccinated people. Measles, also known as rubeola, is a pathogen of the Paramyxoviridae family. It is a spherical enveloped virus with a non-segmented linear RNA arrangement. Understanding its structure helps us to see how it infects and spreads throughout the body. Measles contains two types of protein spikes, F and H proteins. The F protein allows the virus to fuse with host cells, enabling penetration and spread. The H protein binds the virus to target cells, allowing for infection. Once inside, the virus replicates, assembles, and spreads to new cells throughout the body. Measles is extremely contagious. 90% of unvaccinated individuals exposed to an infected person will contract it. The disease progresses through three stages. First, prodromal, with flu-like symptoms such as fever, dry cough, conjunctivitis, coryza, and Koplik spots in the mouth. The second stage is called the eruptive stage, where the rash occurs 7 days post-exposure. It is categorized by large flat spots and small raised bumps. It starts from the face and neck and spreads downwards, followed by convalescence. The rash fades after 5 to 6 days in the same order that it appeared, leaving peeling skin and brown spots. The rest of the symptoms subside over time. The three C's, coryza, cough, and conjunctivitis, are often the main clinical markers that we look for in diagnosis of measles. After exposure, measles incubates for 7 to 14 days before symptoms appear. The virus first infects the respiratory system, where it grows within the epithelial cells, then spreads to lymph nodes, infecting lymphocytes, multiplying, and spreading to the spleen, liver, bone marrow, and other organs before eventually reaching the bloodstream. This leads to secondary viremia, finally triggering the full-blown symptoms of measles. Measles is found worldwide, but is most common in regions with low vaccination rates like parts of Africa, the Middle East, and Asia. The highest risk groups include pregnant people, young children, and those with weakened immune systems. Measles can lead to serious complications. Pregnant people risk premature birth, low birth weight, fetal malformation, and pregnancy loss on top of other complications. Children under the age of 5 may suffer from pneumonia, encephalitis, or even a wiped out immune memory. In general, other complications include secondary infections and, in rare cases, a severe brain disease called subacute sclerosing panencephalitis. In developing countries, fatality rates for high-risk groups can reach 12%. Complications like viral pneumonia, secondary bacterial infections, and encephalitis contribute to mortality. This emphasizes the importance of prevention and treatment. Measles spreads through airborne particles and direct contact with infected nasal or throat secretions. The virus remains contagious in the air or on surfaces for up to 2 hours. A person with measles can spread it from 4 days before the rash appears to 4 days after. There is no cure for measles, only careful therapy once it is contracted. Hydration and good nutrition are necessary to help mitigate the symptoms, as well as the administration of vitamin A to reduce complications such as eye damage or blindness. Special treatment does exist for high-risk individuals, mainly consisting of either administration of the MMR vaccine within 72 hours of exposure and/or immune globulin administration within 6 days of exposure. In pregnant individuals, it is important to note that the vaccine is contraindicated. The best course of action is to get the MMR or MMRV vaccine to provide effective protection against the measles virus. Testing to diagnose measles consists of blood testing for immunoglobulin G or H measurements, an RT-PCR test on urine samples or swabs taken from pharyngeal or nasopharyngeal regions, and viral isolation testing. Clinical manifestation of the triad is also noted in this process. In 2000, measles was declared eliminated in the United States. However, recent outbreaks have surged. As of May 2025, over 1,000 cases have been confirmed across multiple states. Unvaccinated individuals have fueled these outbreaks, and concerns have been raised over rumored measles parties, similar to chickenpox parties, but far more dangerous. Health officials, such as the U.S. Health Secretary, have strongly advised against this practice and encouraged people to vaccinate against measles. In conclusion, measles is a preventable yet deadly disease. Understanding how it spreads, its complications, and the importance of vaccination can help reduce cases. Protect yourself and your community. Get vaccinated and help prevent future outbreaks. Thank you for your time.